Okay, so picture this. You're in a hospital, like top-notch, the kind of place where money is no object, and a child, let's say, is diagnosed with a really rare, very aggressive cancer. And the best specialists in the field get together. They're poring over scans, genetic markers, you name it, and finally they agree on a treatment plan, the standard of care, the absolute best they can offer. But now, imagine this at the same time, just down the hall, the same child's data, totally anonymous, is being fed into an AGI system.
An AGI system.
Yeah. So this system has been trained on like every medical textbook ever written, every genetic mutation we know of, and millions of patient outcomes. And here's the kicker. It doesn't just flag the cancer. The human doctors found it spot something even earlier, a tiny, almost invisible precursor, years before it would have shown up on any scan.
Wow, that's a powerful image you're painting.
And the crazy thing is the AGI recommends a simple early intervention, almost 100% success rate.
So two paths, two very different potential outcomes.
It's exactly. It makes you think right about which one offers the truest hope for the future of healthcare.
Absolutely. And that's the kind of question, the kind of high-stakes dilemma that's at the heart of what we're diving into today. This idea that we're on the verge of a total transformation in healthcare, driven by this incredible force, artificial general intelligence.
Welcome back to the Deep Dive, everyone, where we cut through the noise, all those dense articles and studies, and give you the real meat of the matter, the stuff that matters to you.
That's right. No need to wade through pages and pages of jargon.
Today, we're tackling the revolutionary impact of AGI in healthcare, how it's changing the very way we detect and treat disease.
And our goal here is to make this complex landscape make sense, to uncover some surprising facts and break down even the most complicated ideas into something we can all grasp.
So to kick things off, how about a little riddle?
Okay, I like riddles.
What has instant access to more medical knowledge than every doctor on the planet combined, can analyze millions of data points faster than you can blink, and never gets tired, never makes a mistake because of fatigue?
I'm going to take a wild guess and say AGI.
You got it, the burgeoning field of artificial general intelligence in healthcare.
Makes sense.
Okay, but let's get specific for a second.
Okay.
We hear AI thrown around all the time, algorithms that can beat chess masters or tell us what to watch on Netflix.
Right.
But what makes AGI in healthcare different? What makes it this potential game changer?
Think of it like this narrow AI that's like your specialist, right? But brilliant in one specific area, like spotting a certain type of tumor on a scan. But AGI, it's more like your general practitioner. It's got the combined knowledge and problem-solving skills of the entire medical field all rolled into one.
So not just faster at one thing, but able to see the whole picture.
Exactly. It can understand and connect information across all sorts of medical disciplines, from genetics to drugs to how diseases spread, stuff that might be missed even by the brightest minds working on their own.
So it's really mirroring human intelligence, but on a much grander scale.
Exactly. And that ability to see the big picture has huge implications for disease detection. Think about it. Our bodies, they're constantly giving off clues way before a disease becomes obvious. AGI algorithms can be trained to analyze mountains of medical images, millions of X-rays, MRIs, retinal scans, you name it, and they're looking for the tiniest anomalies, the ones that could signal a disease in its earliest stages, maybe years before traditional methods would even catch it.
It sounds almost like predicting the future of your health.
In a way, it is, and we've already seen some impressive results, like studies showing AI algorithms that can interpret chest X-rays for pneumonia and even subtle signs of pulmonary fibrosis just as accurately as experienced radiologists, sometimes even better.
Really?
Yeah, and what's fascinating is it's not just about speed, it's about the AI picking up on tiny textural changes in the lung tissue patterns that are so subtle they could easily be missed by the human eye, especially when you're dealing with so many images.
So it's like having a second set of superpowered eyes, always on the lookout.
Exactly, a constant vigilant check. And this goes way beyond just radiology. Think about analyzing digital images of skin lesions to diagnose things like leprosy. In places where there aren't many dermatologists, an AI-powered system could analyze a simple smartphone photo and give a preliminary diagnosis. People in remote areas could get treatment faster and avoid the long-term damage the disease can cause. It's about bringing that expertise to the people who need it most.
That's amazing. And what about all those times we've all been there? You have a weird symptom and you Google it and end up convinced you have some rare tropical disease.
Oh, yeah. We've all been down that rabbit hole.
So is AGI playing a role there too in helping us figure out what's actually going on?
Absolutely. We're seeing AI-powered tools that can analyze the symptoms you describe and suggest possible diagnoses. You know those apps where you put in your symptoms and it gives you potential explanations and tells you whether to see a doctor?
Yeah, I've seen those.
Well, those are powered by AI, and they're drawing on this huge database of medical knowledge. Of course, it's not a replacement for a real doctor's visit, but it can help people make more informed decisions about their health and maybe even give doctors a head start by providing some initial information.
So it's like having a really smart virtual triage nurse.
Yeah, something like that.
Has there ever been a case where an AI actually diagnosed something that doctors had been struggling with for a long time, like a real mystery case?
There are more and more of these stories coming out. Imagine a patient with a bunch of seemingly unconnected symptoms. Different specialists might focus on their own areas and miss the underlying cause.
Because it's outside their specialty.
Exactly. But in AGI, it can process the whole picture, all those symptoms, and find subtle links that point to a diagnosis that human doctors might have missed for months or even years. These are the moments where the AI really shines, connecting those dots that we might never have seen.
It's like the AI is some kind of medical Sherlock Holmes.
That's a great analogy. So we've talked about how AGI is revolutionizing how we find disease, but what about treating it? What happens once we have a diagnosis?
Yeah. How does AGI change the game there?
This is where it gets really exciting. Think about drug discovery. Traditionally, it takes decades, costs billions of dollars, and most of the time, those efforts fail. AGI is changing all of that. It can analyze massive amounts of genetic data information about all sorts of chemical compounds and results from clinical trials to pinpoint potential new drugs or even find new uses for existing ones.
So repurposing old drugs to treat new things, that sounds incredibly efficient.
It is one great example is Benevolent AI. They used their AI platform to identify baricitinib, a drug already used for rheumatoid arthritis, as a potential treatment for COVID-19.
Oh, wow.
And they did it in just a few weeks, which is unheard of with traditional research methods.
That's amazing.
Another company, Exscientia, they used AI to find a new molecule for obsessive-compulsive disorder and got it into human trials in record time.
So AGI is basically crunching all this data and finding new avenues for treatment much faster than we ever could before.
Exactly. It's like having a supercomputer dedicated to solving medical puzzles.
Okay, so we touched on this idea of personalized medicine tailoring treatments to each individual. Can you explain a little more about how AGI makes that possible?
AGI is basically the key to precision medicine. It can analyze your unique genetic makeup, your own biological blueprint, and predict how you'll respond to different medications. We know that your genes play a huge role in how your body processes drugs, how fast you absorb them, how well they work, and whether you'll have side effects.
So it's not one size fits all anymore.
Exactly. AGI can sift through all that complex genetic information along with other data like your lifestyle and medical history to help doctors create a treatment plan that's specifically designed for you.
So it's treating the person, not just the disease.
Right. So imagine someone diagnosed with cancer, AGI, can analyze the genetic profile of their tumor and figure out exactly which mutations are causing it to grow. Then doctors can choose targeted therapies, drugs that attack those specific cancer cells, which means they're more effective and have fewer side effects on healthy tissue. This kind of personalization just wasn't possible before AI.
So it's like having a custom-made treatment plan for your specific illness. That's pretty incredible.
It really is, and it offers so much hope, especially for people with complex or rare conditions.
I was just thinking about that. What about people with rare diseases where there's not much research or maybe no established treatment protocol? How can AGI help them?
That's a great question, and it's an area where AGI has a lot of potential. Take a patient with a rare genetic disorder, for example. Diagnosing these conditions can be a nightmare, and finding the right treatment can be even harder. AGI can analyze the patient's genetic data, compare it to this huge database of rare disease information, and potentially find existing drugs, maybe even drugs used for totally different conditions that could be repurposed to treat this specific disorder.
So it's like AI is a detective for rare diseases, finding those hidden clues that could lead to a cure.
Exactly. It's all about making those unexpected connections and finding those hidden therapeutic opportunities.
This all sounds incredibly promising. But are there any potential downsides or challenges we need to be aware of?
That's a crucial question, and it's one we need to be talking about. One of the biggest challenges is the sheer volume of data that AGI relies on. We're talking about enormous data sets of patient information, medical records, genetic data research findings. Managing and interpreting all of that information responsibly and ethically is a huge undertaking.
That makes sense, like drinking from a fire hose of data.
Exactly. And then there are the ethical concerns around privacy and security. How do we ensure that all this sensitive health data is protected from misuse or breaches? How do we prevent discrimination or bias from creeping into these algorithms, especially when they're trained on data that might reflect existing health disparities?
Yeah, those are really important considerations.
Absolutely. And then there's the question of explainability. Can we understand how the AI is arriving at its diagnoses and treatment recommendations? Or is it a black box where we just have to trust the output without knowing the reasoning behind it? These are all questions that we need to be grappling with as AGI becomes more integrated into healthcare.
So it's not just about the technology itself, but also the ethical and societal implications.
Exactly. It's about ensuring that this powerful tool is used responsibly and equitably for the benefit of all patients.
So where are we seeing AGI being implemented in the real world? What are some concrete examples of how it's already making a difference?
We're seeing some fascinating applications across the globe. For instance, in India, AGI is being used to combat fraud in their national health insurance program. Algorithms analyze claims data, looking for suspicious patterns and anomalies, helping to ensure that resources are used effectively and reach the people who need them most.
So AI is acting as a watchdog for healthcare resources.
In a way, it is. Another exciting area is early breast cancer detection using AI-powered thermal imaging. Companies like Neuromai are using this technology to provide affordable and accessible screening in areas where traditional mammography might not be readily available.
So it's hoping to bring life-saving technology to underserved communities.
Exactly. It's about democratizing access to quality healthcare. We're also seeing AI being used to predict sepsis in newborns based on the mother's risk factors and the baby's vital signs. This kind of early detection can be critical for preventing serious complications.
Wow, that's incredible using AI to protect the most vulnerable patients.
Absolutely. And in low resource settings, AGI is being used to optimize medical supply chains, predict disease outbreaks, and even provide virtual medical advice through chatbots. It's about finding innovative ways to leverage technology to bridge gaps in healthcare access and delivery.
So it's not just about fancy hospitals and cutting-edge research. It's about bringing the power of AGI to the people who need it most, regardless of their location or resources.
Exactly. It's about using this technology to level the playing field and ensure that everyone has a chance at a healthier life.
And with all the data our smartphones and wearable devices are collecting, it seems like there's even more potential for AGI to personalize our healthcare experience.
Absolutely. Our everyday devices are becoming powerful tools for health monitoring and data collection. AGI can analyze this data in real time, looking for subtle changes that might indicate a developing health issue. Imagine a system that notices a slight change in your gait or heart rate patterns that could be early signs of a problem.
So it's like having an AI health coach constantly monitoring your well-being.
In a way, it is. This constant stream of data, when analyzed by AGI, can lead to more proactive and preventative healthcare. It's about shifting from reacting to illness to actively maintaining your health.
But doesn't that raise concerns about privacy and data security?
Absolutely. That's a crucial part of the conversation. As we embrace the possibilities of AGI in healthcare, we need to be mindful of the ethical implications and ensure that individuals have control over their data and how it's used.
It's a delicate balance between leveraging the power of technology and protecting individual rights.
Exactly. It's a conversation we need to have as a society as we move forward into this new era of healthcare.
So with all these exciting developments and potential challenges, what do you see as the biggest hurdles to integrating AGI into existing healthcare systems?
One major challenge is the lack of interoperability between different electronic health record systems. If we want AGI to be truly effective, it needs access to comprehensive and standardized patient data.
So it's like trying to solve a puzzle with missing pieces.
Exactly, and then there's the human factor. We need to ensure that AGI tools are designed to be user-friendly and seamlessly integrated into the workflows of doctors, nurses, and other healthcare professionals.
So it's not just about the technology itself, but also how it's implemented and adopted by the people who be using it.
Exactly, and we've seen some high-profile failures in the past where tech companies tried to force-fit AI into healthcare without fully understanding the complexities of the field.
So it's a lesson learned that collaboration and understanding are key.
Absolutely. We need collaboration between tech companies, medical experts, regulators, and patients to ensure that AGI is implemented responsibly, effectively, and ethically.
So it's a multifaceted challenge that requires a holistic approach.
Exactly. It's about working together to create a future where technology empowers better healthcare for everyone.
This has been an incredible deep dive into the world of AGI in healthcare. It's clear that we're on the cusp of a major transformation with both incredible potential and significant challenges to address.
Absolutely. It's a rapidly evolving field, and it's exciting to see how it continues to unfold.
So as we wrap up, what's one key takeaway you'd like our listeners to remember?
I think the most important thing is that AGI has the potential to revolutionize healthcare in ways we can only begin to imagine. But it's not a magic bullet. It's a powerful tool that needs to be developed, implemented, and used responsibly and ethically.
That's a great point.
And I'd encourage everyone to stay informed and engaged in the conversation about AI in healthcare because it's a conversation that will shape the future of medicine and ultimately our health and well-being.
And on that note, we've reached the end of this deep dive into the fascinating world of AGI in healthcare. Hopefully you've all come away with some new insights and a sense of wonder about what the future holds. But before we go, I'd like to leave you with something to think about. If AI can already achieve so much in understanding and treating disease, what other seemingly impossible challenges might it help us overcome in the years to come? That's a question worth pondering long after our conversation ends. Until next time on The Deep Dive.